Good afternoon. This is Dr. Kris from Danette Family Chiropractic, and I'm here today with Dr. Karen Bumpus. Dr. Bumpus is a physical therapist practicing in the South Shore area, although unfortunately she'll be relocating to Burlington, Vermont, where she'll be working at a clinic, All Wellness. She received her doctorate degree in physical therapy in 2016 at UMass Lowell, and since then she's been working on women's health and pelvic floor dysfunction at Marathon Physical Therapy and Sports Medicine right down the road. So welcome, Karen. So good to have you here.
Thank you. Thank you. Good to be here.
So what drew you to this line of work? Because as a physical therapist, you could basically work on any population and anywhere. So what kind of drew you to women's health?
This is a question that I get a lot because people are curious. Basically, when I graduated, I was sort of in that new grad phase of not knowing what I really wanted. And I actually was able to attend a lecture where the owner of Marathon, or one of the owners, and the leader of the women's health program did a talk, and she kind of just filled us in about all of the needs that there are in this area and how underserved this population is, and just how there's just a supply-demand issue basically with PTs to people who need it. And I thought, well, I'm not shy and I don't scare too easy, so I might as well play to my strengths and dive in. And luckily I started out and I loved it. So it's really been the only type of PT that I've done outside of like nursing home and stuff, because I just love it so much. So yeah.
Good for you. Awesome. We're definitely glad you are serving the population. So can you, let's get right into it. Can you tell us what is pelvic floor dysfunction? Like, what is the pelvic floor for those who aren't familiar with anatomy?
So the pelvic floor basically refers to that sort of surround our private areas. So females, the muscles surrounding the vagina, the anus, and it's basically this network that sort of supports us from the bottom. So the way our skeleton's made up, that bottom part, that bottom opening, that outlet is all muscular support, because we have to be able to birth babies out of there. It has to be able to open up greatly. So there's not a lot of bony support there. So this is just really a key group of muscles that is easily forgotten because it's in such a private area, but they play a huge role in bathroom function. So urinating, defecating, and then childbirth, of course, sexual function. So they do play a pretty big role. Pelvic floor dysfunction is basically if any sort of aspect of the roles of these muscles is not going quite well. So this could be tightness, it could be weakness, or it could be something that's injury related, like an episiotomy or any sort of tearing or any direct trauma. So there's a lot of different terms and a lot of different dysfunctions that can fall into the category of pelvic floor dysfunction. So yeah, basically any sort of disorder that's being affected with those muscles.
And how common is it?
Well, it's really hard to say. So it's kind of underreported. And honestly, I don't have a direct statistic in front of me, but I can tell you that just based on what I've seen, I see on average about 50 people per week. And we've got, wait lists kind of across the board just in the Boston area. So if you are somebody that's finding that you might fit this mold, you're definitely not alone. I don't want to throw any numbers out there because I honestly don't have them off the top of my head. But again, it's also generally underreported because it is so private and so personal. And people also don't realize that there are treatments out there like pelvic floor PT.
Nobody wants to mention it to the doctor, like I said, because it is a very private area and nobody wants to admit their symptoms either. So can you tell us a little bit about what the symptoms would be if you had dysfunction?
Depending on what's being affected, there can be a few. So some of the more obvious ones are incontinence. So if you're leaking urine, either with activity like exercises, a lot of women after babies especially will say, I can't jump rope or I can't run, or jumping jacks are my enemy, and things like that I hear a lot. So that's a sign that those muscles aren't doing what they need to for you. Otherwise, pain is a big symptom that I think a lot of women just kind of overlook because either they're mothering or they're just trying to make it through their day and they're like, all right, I'm just going to ignore. But any sort of vaginal pain, it can be pain with intercourse, pain inserting a tampon, or sometimes just pain at rest. That's an indicator that things could be kind of off down there. And then constipation or pelvic organ prolapse. So that's a lot of women will call like a falling bladder or falling uterus. And that is usually identified by like a pressure. I'll usually hear people say, I've got a pressure or heaviness, or some people can even feel a little bulge at their vaginal area. So those are all signs. Other signs include frequency of urination. So running to the bathroom, every hour. That's a sign that something's up. And any sort of pain occurring with going to the bathroom. So those are, I guess, some of the big red flags that you might want to check in with your doctor and see what could be going on.
Okay. Now with the organ prolapse, is that more of a medical emergency, or is that again just something that comes along with the dysfunction part of it?
So pelvic organ prolapse isn't necessarily a medical emergency. If somebody prolapse to the point where they're having like they can feel that their bladder is external, it can be very, very alarming. Yep. And, definitely something you do want to check in with your doctor sooner rather than later. It's not dangerous in itself. The prolapse doesn't necessarily mean that something terribly dangerous is coming on, but it is going to put you at risk for infection. It can put you at risk for urinary retention, and it's just something that you definitely want to be addressed.
So any kind of pressure, you definitely want to check in with your medical doctor.
Absolutely.
And get that taken care of. Okay. Are there any particular groups more prone to pelvic floor dysfunction than others?
So the biggest group, that people can kind of guess is moms. Once you've had a baby, either if it's a vaginal delivery or C-section, it doesn't matter. One doesn't outweigh the other. You're more prone because you've now used that pelvic floor. And you've basically undergone a trauma. Childbirth, either way you do it, it's traumatic. Even if everything goes well, it's an injury to your body. Those muscles are being incredibly stretched. So moms definitely are a little more prone. But otherwise, it really doesn't discriminate. Men can have pelvic floor dysfunction, men who have had prostate cancers or prostate surgeries, or sometimes men that are very athletic, and women like gymnasts and people like that can have a lot of tightness in their pelvic floor. Mm-hmm. So it doesn't discriminate too much, but moms are definitely more likely, I guess, more prone.
And it's important to note, too, what you said is it doesn't matter if you had a vaginal delivery or not. Even women who have had C-sections can also have pelvic floor dysfunction.
Definitely. Actually, there's some research that shows that women who have had C-sections are more prone to painful intercourse 1 year after. So I know that a lot of... Sorry?
I said interesting.
Yeah, no, I was definitely interested. And I think a lot of women who have had C-sections sort of discredit their pain if they have vaginal pain because they think, well, I had a C-section. This doesn't make any sense. It must be in my head or it must be something else going on. But, you are still very affected. And sometimes, especially if it's an emergency C-section, your body was still preparing for that vaginal delivery. Your baby has maybe even entered the birth canal and really made it almost through that pelvic outlet when you're getting the C-section. So stuff's still affected for sure.
Can anything be done? Let's say a woman's pregnant right now. Can she do anything to prevent this, to prevent pelvic floor dysfunction?
So good pelvic floor habits, I guess that you can kind of do just generally at home. One is definitely just tracking where you are now, because then you're going to be able to tell what's changed. So noticing, how often you're going to the bathroom, trying to eliminate just in case trips, which are usually like, oh, I'm about to leave the house, or, oh, I just got home, because those can really add up and lead to some urinary problems. Otherwise, just engaging with your pelvic floor. The two main ways that you can do that is diaphragmatic breathing. And that's where you get a lot of lengthening and mobility for your pelvic floor, and just kind of helps you translate pressure and feel those muscles sort of stretch. And then the one that everyone knows about is Kegels. So I think that that's like the more popular pelvic floor exercise. And Kegels are good, so it is good to maintain good strength and just ability to contract. But one thing that I like people to know about Kegels is they're not necessarily a one size fits all. So just like, if somebody had a bicep injury and they were coming into PT, we wouldn't necessarily jump right into, we'll just do bicep curls, and you'll be fine, because it kind of depends on what's going on. So if you are someone that does them at home, just know that you're doing it right. So do a little research, do a little reading. There's ways to cue yourself just to know that things are actually coming upward when you're contracting and you're not pushing down. Otherwise, don't go crazy, because Kegels tend to be something that people are like, oh, I remember to do them today, I'll do 100, or they're just going to forget for 3 weeks. I can identify with that. So yes. Definitely trying to keep it to like 30 per day is pretty good, as a general rule of thumb, to keep you from entering that like 100 rep category because you remembered today and you're feeling super awesome. And then if you feel that the Kegels are making your symptoms worse, that could indicate that you have some pelvic floor dysfunction or some tension, and that the Kegels might actually not be a great idea for you. So Kegels are great, but exercise caution.
Yes. Do you have any places to go if somebody doesn't know how to do Kegels, or any like websites that you can recommend where they can go and learn how to do them?
So Google's great. And usually if you do like look up, like the proper way to do a Kegel, and you're finding that it's an article that seems like a little bit more on the scientific side, you can trust it. The hardest part is cueing. So, if you're really confused or it really seems like it's going wrong, as weird as this sounds, if you sit on your hand, you can actually like sit, you want a kind of a flat surface, and you want to sort of curve up and inward. You don't have to go internally or anything like that, but just get close enough that you can feel what your pelvic floor is doing. So you want to be around the sits bone. And I actually have a model, so I can show you where that is.
Perfect.
Ta-da! Here's a pelvic floor. So these are the sits bones. And when you're sitting, if you sit on your hand, it feels like a little golf ball rolling around. And it's right around where your butt cheek meets your leg, I guess, to be not so scientific. So if you go midline to that, that's going to be all pelvic floor muscles. So sorry if this is a graphic image for some, but this is the pelvic floor. And if you're there, you'll be able to feel. So when you're doing the Kegel and you're on that contraction phase, you should be able to feel a tightening and a drawing inward. And if you're feeling something bulging down and pressing into your fingertips, that's saying that you might not be doing things quite right. Okay. So the cue that I like to tell people is kind of act like you're picking something up with your vagina, like you're trying to pick up a little pearl, and it tends to work.
Okay. Yeah, that's a good visual.
Yeah.
What about the diaphragmatic breathing? Any tips with that, or any websites that you can recommend on how to do that properly?
Let me think off the top of my head. So one of the pelvic floor PTs that I like, her stuff a lot is someone named Diane Lee, and she talks a lot about like pelvic floor physiology as it relates to the core, because pelvic floor does correlate a lot with your core muscles, like your abdominals and things like that. So she's a great one. And in terms of trying diaphragmatic breathing at home, lying on your back is usually easiest just because you won't be using as many muscles to support yourself. I usually like one hand on the upper chest and one on the belly. And then your inhale, they should rise, exhale, fall. And less is more. So a lot of people, when they go to do the belly breathing, they kind of tend to overinflate. You want it to be controlled. I always say long and slow is better because you're doing it for relaxation. You're not trying to pop a lung. And then again, if you use that same sort of pelvic floor cue that we talked about with the Kegels, and you kind of place your hand in that same area, you'll be able to feel your pelvic floor very subtly move downward on the inhale and return on the exhale. It's a super subtle movement, so if you don't feel it at home, don't panic. You can go back to the hands on the chest and the belly.
Perfect. And now, for the people who feel that they would need a physical therapist, what could they expect going to a professional or seeking professional help? Is it something they go through their medical doctor first, or would they go right to Marathon?
So typically it depends on insurance. We are a direct access state, which means that if your insurance allows it, you can just walk right in and make an appointment. Either way, if you call us first, we'll let you know if you need to see a doctor and get a referral or a script. We can run those numbers and let you know what you need. But first visit is the initial evaluation. So that's kind of just where you come in and, we'll get to know your story. So we'll do an interview, kind of figure out your sexual, bowel, and urinary health background. And then we do a physical assessment. And that is kind of just looking at hips, low back, core, and pelvic floor and putting all of those pieces together. And then based on your history, if there sounds like something else that we want to look at, we will. Sometimes we do an internal exam. People tend to be a little caught off guard by this. It's not something that we're going to force upon you. So if you come in and you're like, I really don't want an internal exam, we won't make you, but it does allow us to get the best idea of what's going on and really, feel what's going on with those muscles, cue the contraction, cue the release, and see exactly how well you're functioning. It's not super scary. I tell people there's no stirrups and no speculum and no scooting. So that's kind of nice. You get to lie down a little bit more comfortably. And we just use gloves and we use just one finger to kind of palpate, and we'll cue you through everything. But it is good for people to know that might be asked of you, but you always have a choice. So it's not forced. So I don't want anybody who's afraid of having an internal exam to not come to pelvic floor PT, because even if you're not ready for that emotionally or physically, there's other things that we can do to help you.
That's very good to know. And if somebody really likes you and is resonating with everything you're saying, how would they contact you?
I'm going to be in Vermont, but my email is Karen, so that's my name, Karen, at allwellnessvt.com. All wellness is all one word. So email is great. And I typically get back to people, I say within one day, unless it's the weekend. So most of the time, but I'm pretty good.
Very reasonable that. Yeah. And I will put your email address, the link for your email address in the comments section of this video.
Perfect.
For people who just want to click right on it. Anything else you want to add?
I think that we covered most of it. I'm just, thank you for giving me this opportunity. And it's so awesome to just get the word out there. So, and if anybody out there has any questions, you'll never make me blush. So nothing's off limits. Feel free, throw them at me. All right.
So again, this is Dr. Karen Bumpus of formerly Marathon Physical Therapy and now All Wellness in Burlington, Vermont. Dr. Karen, thank you so much for being with us today. You gave us so much great information.
Yeah, thank you. All right.
Again, this is Dr. Kris from Dynette Family Chiropractic in Easton. We are here to help and serve you in any way we can. If you want to get in touch with Dr. Karen. Her email address will be in the comment section. Make it a wonderful week, and thank you so much.
Thank you.